Welcome back. You've probably experienced Canada's healthcare crisis firsthand. There's long wait times, surgery delays, emergency room closures. But for nurses, this crisis dates back far before the pandemic.
So the nursing crisis demands urgent action. So registered nurse and healthcare equity advocate Amie Archibald-Varley is here to discuss today all of that with us. Welcome to the show, Amie.
Thank you for having me.
So I think we can look at this nursing crisis perhaps in three stages. So there was pre-pandemic, already in crisis mode, the peak of the pandemic, and then where we find ourselves today. So we know the pandemic, technically it's not over, although a lot of people feel it is. But for nurses, how have things changed across these three stages?
Yeah, I mean, when I think about that, I think about the fact that in terms of nursing, there has been a long-standing chronic nursing shortage. So this actually was something that happened well before the pandemic, and that the pandemic actually exacerbated this problem, made it actually way worse. So, we've seen at the very beginning of the pandemic, people banging pots and pans, right? Saying, great, nurses are doing so much. And then kind of now as it's petering out, we're not hearing that energy. And that's what the most difficult piece is, knowing that we're still facing a crisis right now where you're seeing those wait times and those challenges in nursing.
And another thing we're hearing is a lot of frustration from people, especially with those wait times in ERs that I heard for anywhere from 9 to 14 hours. But on the other side of that, there is a staffing shortage. So talk to us in your experience, what's it like to be so understaffed and have everybody so frustrated?
Yeah, I mean, one of the things that I would like to say is it's moral injury, right? We want to be caring for our patients and families, but we don't have all the skills and the tools and the equipment that we actually need. And one of the things I've said is, could you imagine trying to do the show, The Social, with just you three hosts? You don't have anybody in the background doing the TV, the production, the sound. No. How would it run? That's how it is in healthcare right now. That's how we're feeling where, maybe the complement should be 10 nurses and we only have 3 coming in on a shift.
Wow.
So imagine how distressing it is knowing that that standard of care, we're not meeting it for our patients and families. It's very, very challenging.
Well, then, it's just staggering to think about. It's not surprising then that a recent Stats Canada survey found that 1 in 4 nurses intend to leave or change their job in the next 3 years. But other research puts that number at 1 in 2 nurses. We often talk about retaining nurses, but you say that there's nothing being done to keep them where they're at. So talk a little bit more about that.
Yeah, I mean, I'm a part of that 1 in 2 statistic. I actually quit my job in the last 2 weeks, and that's the challenge is flexibility and scheduling. We don't talk about enough about retention, and really nurses are asking for simple things like flexibility and schedule, safe patient ratios. We're asking for paid sick days. Some nurses don't have paid sick days, and we're also asking just to be able to take our vacation time. So there are some folks that have been asked to not take vacation time and to have that paid out. But how would that look? How would that work for our mental health stress if we don't have that time and that rest that we need?
It's just unbelievable, the things that you're saying this right now. But here in Ontario, there's a law that limits wage increases for nurses to 1% per year. Now, while this isn't the same case across Canada, the pay issue is a major issue across the country. So talk to us about that.
Yeah, so that bill is Bill 124, and it actually caps nurses' wages at less than 1%. So if you think about inflation, it's been over 8%, and it's actually capping nurses' wages at less than 1%. And that's really, really challenging. And one of the things that we're asking for is to see better pay. Nurses typically make about $33 an hour, and then between year 8 and 25, no pay increase. So that's some of the things that we're dealing with.
So you say a big part of this problem, though, is that people don't actually really understand exactly what it is that nurses do. So what are we missing here?
Yeah, I mean, one of the things I like to ask you guys, or you ladies, I should say, is name a famous nurse. Right? So most people will say Florence Nightingale. There are nurses that are working in such various different areas that we don't even know. One of the nurses I look up to is Cori Bush. She's a politician, but she also was a nurse before that. We need to start seeing nurses in various different roles. And, having me here today is one perfect example of where we can, represent nurses and see nurses and elevate their voices in a different way.
So there's obviously a ton of work that needs to be done by both the federal and the provincial governments to address this shortage. But is there anything that is being done now that is at least a sort of step in the right direction?
Yeah, one of the things that nurses have been advocating for before was internationally educated nurses. So this is looking at having nurses that can help come and support the workforce, because we've been saying that there's this chronic nursing shortage. So using internationally educated nurses would be a really great aspect. And then also making sure that we don't exploit them, because we want them to have, all the same benefits that we would have, like paid sick days if they're full-time, and then, having benefits as well. So those are some of the things, and they're actually looking at that for physicians as well.
That's a really good idea. In the beginning of the pandemic, we saw people beating pots and pans every evening in support of nurses and healthcare staff. That seemed to just stop. I don't know why or how, but for some reason it stopped. What kind of support would you like to see now?
One of the things that I'd like to see is support at the polls. I think it's so important to think about the intersection of healthcare and policy. That is one of the biggest things that we've seen. And we need to make sure that people understand what's happening in policy. So reach out to your MVPs, reach out to your MPs, and find out what are the health policies that are coming into place. That would be the biggest help for nurses at this point, to make sure that, we're looking at healthcare not just for some people, but for the health of all Canadians here.
Do you think there's any chance you would ever go back to nursing?
I'm always going to be a healthcare advocate. I think health equity is one of the biggest important things that we should continue to talk about. So I will always be a nurse at the bottom of my heart. That will never change, and I will always be advocating for the health of all Canadians.
Amie, thank you so much for being so candid. A lot of work to be done.
Hey there, wasn't that great? Do you know where you can find some equally good content? Our YouTube page. It's filled with discussions, debates, and some laughs. Head there now, like and subscribe.